cancer. In 1970, Nixon launched a war on cancer, that in 30 years, in 2000, we will win the war on cancer. We are nowhere near that. Now, if I have to tell you in nutshell, in very brief, that how we can win the war on cancer, and not only cancer, but non-communicable disease. See, you must understand that 20 years back, people used to die of cholera. People used to die of malaria and infectious diseases. Now the things have changed. We have conquered the infectious diseases, which used to be called communicable disease, but now we are having the burden of non-communicable disease. These non-communicable diseases, they are diabetes, cardiovascular, hypertension, cancer, and chronic obstructive pulmonary disease, those lung diseases. Now, these four diseases, they are causing 63% of the deaths in the current society, and therefore, the emphasis currently is not the communicable disease, but the non-communicable disease, and that is why in 2011, for the first time in the history of United Nations had to call a meeting for tackling the non-communicable diseases. And when United Nations calls a meeting of their more than 175 nations, you can imagine the gravity of the problem. The world is suffering not because of the health care, because of the non-communicable disease and people dying. The world leaders are worried because almost 10% of the GDP is getting affected by the non-communicable disease. That means the governments are waking up because deaths because of non-communicable disease, they have become the financial issue, not the health issue. And that is why they came together, they discussed about the tackling of the non-communicable disease. And how do we tackle? These are the evidence-based strategy for tackling the non-communicable disease, which includes cancer. And this is the holistic approach. First is the tobacco use. It's not a rocket science, everybody knows. And if you look at the cost effectiveness, what will happen if there is a control of tobacco, you can see that. Dietary salt. Do you need some kind of, expensive technology to change the pattern like CT scan or some expensive machine for checkup? No, you just need to reduce your dietary salt. And that tackles all the non-communicable disease, including cancer. Obesity. A lot of people, they love to have their children little bit of roly-poly and, obese, and they love that. They believe that that is a sign of a good father and mother. What we don't realize that by inculcating the habit of the junk food, childhood obesity is linked with many future non-communicable disease. And therefore, unless we train our children about the healthy eating habit and we don't follow in our own personal life those vada pavs and samosas and bhajias and all that, obesity, particularly truncal obesity, is responsible for not only hypertension and diabetes but also cancer. We'll be talking about it. Alcohol intake, somebody said, the previous speaker. Whenever we talk of alcohol in a medical community, people feel that it is a very moralistic approach. Not at all. 30 years back, I remember in the medical conferences, doctors used to smoke. Doctors used to smoke in hospital. But now it is looked down upon. Now doctors cannot do a socially downbeat activity. Alcohol intake is one of them. And this is not my personal opinion. This is not some religious practice or this is not some political agenda. This is the UN agenda described by the United Nations based on the evidence. And this United Nations treaty is adopted by the government of India, and therefore government of India is committed to alcohol control. And who should be the leader in this government of India's effort? Doctors. Doctors have to practice what they preach, and we must tell our patients. And one thing again, people say that alcohol has got a safe level. Completely false. If you search Google, don't trust me, there is no safe level of alcohol. that 2 to 3 pegs a day and 6 pegs a week and all that, it reduces the risk of disease. It does not eliminate the risk of disease. The choice is yours, whether you want to reduce the risk of cirrhosis or you want to eliminate the risk of cirrhosis. And that is what people have to understand, that unless doctors start counseling the patients like they are doing for tobacco these days, we will not win the war on cancer or non-communicable disease. And exercise.